Hi friends, let's try to understand the role of sentinel lymph node biopsy in the management of breast cancer. First of all, what is sentinel lymph node? Sentinel lymph node is considered to be the first lymph node which drains a cancer. And sentinel lymph node biopsy means removal of that lymph node from the body and looking under the microscope for the evidence of cancer is sentinel lymph node biopsy. Now why this sentinel lymph node biopsy is done? What is the concept behind the sentinel lymph node biopsy? It is based behind the concept that if the sentinel lymph node or the first lymph node is negative for the cancer, we consider that the cancer will not go to any other lymph node. So if the sentinel lymph node is negative for the cancer, it means the cancer has not gone to any other lymph node. And if it is positive for the cancer, it means that the patient needs further lymph node clearance for the proper cure of the cancer. Now, how it is done? It is done by injecting either a radio-labeled colloid or by some dye like isosulfan blue dye around the tumor. And these dye or these colloids will go into the lymphatics, and these will ultimately go into the lymph nodes. The first lymph node which is taking these dyes or the colloid are taken from the body and properly sectioned and seen under the microscope. This is how sentinel lymph node biopsy is done. Now coming to its role in the breast cancer. Considering the breast cancer, the most common lymph node site metastasis is axilla. So in the axillary lymph nodes, we divide the axillary lymph nodes into three parts: level 1 lateral to the pectoralis minor, level 2 behind the pectoralis minor, and level 3 medial to the pectoralis minor. It's the most very difficult to remove the level 3 lymph nodes, and now it has been proved that removal of level 1 and level 2 lymph nodes is enough to cure most of the patients. So now if the patient is having a breast cancer but the axilla is free of metastasis, there is no axillary lymph node on the clinical examination. So what we can do is we can go for sentinel lymph node biopsy, and if the biopsy turns out to be positive, the patient will go for axillary clearance, lymph node clearance, and if it is negative, there is no need to go for axillary lymph node clearance. Now why there is so much fuss? Why can't we go for axillary lymph node clearance in all the patients when we know that the breast cancer mainly goes to the axillary lymph nodes? The problem is that most of the morbidities of the surgery being done for the cancer of the breast comes from the axillary lymph node dissection. Because of the axillary lymph node dissection, there is a risk of nerve injury, there is a risk of arm dysfunction, there is a risk of edema, lymphedema, which can later give rise to some sorts of malignancy also. So basically most of the morbidities comes from the axillary lymph node dissection. So if the sentinel lymph node is negative, we consider that the patient is lymph node negative or lymph node free disease. In these patients, there is no need to go for axillary lymph node clearance, and thus saving the patient from the much of the morbidities related to the management of the breast cancer. This is all in short about sentinel lymph node biopsy in the breast cancer. Thank you.